Hi everyone, Dr. Remy from Pain Free and Fit. Today we've got a great home self-treatment exercise to help relieve the neck pains associated with cervical degenerative disc disease. Of course, this is not supposed to make up for proper medical care, but it can go a long way to helping relieve your pain. Hope you enjoy it. So this positional release technique is based on the idea that many times your neck pain with cervical degenerative disc disease is coming from some type of asymmetrical stress that's being applied to your neck. Many times the musculature on right and left sides of the neck are not symmetrical, or from front to back sides of the neck are not symmetrical. And as a result, it's causing a perpetual asymmetrical force running through your spine that's compressing disc fibers. It's causing muscle strain and spasm trigger points. It's causing joints to lock up, hypomobility, or even hypermobility, another joint, meaning too much motion that's contributing to your pain. So this particular exercise we have in terms of how you treat your own pain at home is designed to release that excess tension in the muscles, thus allowing the spine to assume a more neutral position and relieving the stress on those various neck structures. Before you begin, you need to know what your unique postural and mechanical issues are, because doing this exercise you need some type of idea, where do I want to go with repositioning my head, repositioning my shoulder blade and my neck. The way you learn that is by doing a body analysis on yourself, because we all have some type of habit of tilting our head to one side, rotating to one side, a shoulder blade that rounds or elevates, and most of the time that's significantly contributing to our pain. So I would invite you to go to either the Posturesize or painfreeandfit.com websites to take the free body analysis and learn what your unique issues are. That way you can plug those corrections into using this positional release exercise. So what we're going to do is we're going to lie face down with or without a pillow. Some of us with cervical degenerative disc disease cannot lie flat with the head all the way down. There's too much pressure on our neck, it aggravates our pain. So what we'll do is we'll use a pillow to support the head. Now, the idea of this is if you have a tendency to tilt your head to one side, to rotate to one side, to hold your shoulder blade forward, upward, downward rotated, abducted, wing, tipped, whatever your situation is, you want to try to bring those areas back into a neutral or straight position first. Then what we're going to do is we're going to try to take our pillow and we're going to move it down. You could even use a couple of towels so it's more towards the base of our neck, where our neck meets my upper back, and allow the head then to roll down off the top of that. What we're trying to do here is cause the lower neck and upper back to move forward and to allow our chin to come down so my neck is not tilted back like this. That's going to cause extension stress in my neck. So I'm going to hold my chin tucked under with a little pressure moving up, and then I'm going to take my fingers and feel on both sides of my neck where I feel the most tension. You may feel a knot or a lump of tightness there. And while I feel that, either on the right or left sides or both sides, I'm going to slowly tilt my head right and left. I'm going to turn it slowly right and left. I'm going to move my shoulder blade back and forward, up and down. And somewhere in that combination of movements, I'm going to get to the point where I feel that knot or that lump or that tension decrease. It's going to become the softest. And I'm going to hold that for 90 seconds. As I'm in that position, it would not surprise me if the position that my head is rotated or tilted to or shoulder blade moves to is in a position towards the alignment of normal posture, away from my area of dysfunction. After 90 seconds, I'm going to slowly bring my head and my shoulder blade back into a neutral position. And I'm going to take my time, rolling to my side, not coming up straight. Notice I'm holding my neck in a neutral position, not changing what I just positioned. And then relax. Now what we're doing here is using a classic osteopathic technique called positional release or strain counter strain to release the asymmetrical tension by affecting the muscle spindle in the muscle that helps to set the tension in the muscles. You can do this several times a day, and what you'll notice is after that If you move slowly, because you don't want any abrupt motion to disturb that muscle spindle and put it back into tightness, the trigger point, the tightness, the stress will many times be significantly relieved. So I hope you can use this to help your cervical degenerative disc disease. If you like it, I would suggest that you subscribe to our channel and learn the supportive exercises and conditioning stretches that help support this type of positional release technique so your pain doesn't keep coming back, so this asymmetrical muscle tightness doesn't keep occurring in your life. If you like this video and want to help me share it with others to provide some more pain relief, please give me a thumbs up below. Leave your comments. I'll do my best to get back to you. And as I said before, I hope this exercise helps you and allows you to stay pain-free and fit.